Good morning, everyone. Welcome. My name is Jerry Altmiller, and I am an associate professor here at the College of New Jersey. So I would like to start off with introducing the Dean of the School of Nursing, Health, and Exercise Science. Dr. Carole Kenner is the Carole Kuzer-Lozer Dean Professor of the School of Nursing, Health, and Exercise Science at the College of New Jersey. She specialized in neonatal perinatal nursing for her master's and obtained a minor in higher education for her doctorate. She has authored more than 100 journal articles and 25 textbooks. Her dedication includes providing a healthcare standard for educating neonatal nurses nationally and internationally. Her passion led her to begin the journal Newborn and Infant Nursing Reviews, which she now serves as international column editor. She helped develop the End-of-Life Nursing Education Consortium neonatal pediatric modules. She is a fellow of the American Academy of Nursing, a fellow of the National Academies of Practice, a fellow in the Academy of Nursing Education, past president of the National Association of Neonatal Nurses, and founding president of the Council of International Neonatal Nurses, the first international organization representing neonatal nursing. She is the 2011 recipient of the Audrey Hepburn Award for contributions to health and welfare of children internationally. Please help me welcome Carole.
Thank you, Dr. Altmiller, and we're very glad to have you here. I've been honored to be the dean here for the almost 2.5 years. And it's a really exciting place to be, especially now since Jerry has brought CUSIN to us. And I mean that with all sincerity. The work that I've done, especially because my background is neonatal intensive care, I've seen firsthand, and I still do visit NICUs as often as I can. Most of the time now it's overseas. And it's brought me full circle to recognize that in education we didn't do a good job for a number of years, frankly, of talking about patient safety, talking about quality improvement. Yes, we had the quality, continuous quality circles that we needed to answer the surveys. And for NICUs, it was always, but except you're different than the rest of the hospital, even though that I was in a children's hospital. But we still didn't really talk about the issues that lead up to why we have so many medical errors and why we have patient safety errors. So as I had the opportunity to work with Anita Finkelman, who is really the brains behind the Teaching IOM book that we did a number of years ago and is going to come out in another edition, and I'm not doing it this year. Somehow this place is keeping me too busy. We recognized that the IOM was coming out with some very important reports, especially in 1999 with the Tu Eres Human report that scared a lot of people, as well it should, that says, well, we may be killing 44,000 patients a year. Maybe it's even 98,000. And those were the headlines that came out in a lot of the press. Of course, who did people start looking at? Oh, the nurses too, right? Because we're the largest segment of the workforce. But the right thing that happened out of that was to ask the right questions. Why are people having either medical errors that luckily are not resulting in death? And why do we have these data that suggest this many people are dying? So over the course of the next few years, President Clinton established the quality circle, I'll call it, the quality series, working closely with IOM to say that we need to really delve more deeply into this issue of quality and safety in our healthcare areas. And in 2003, the report came out that suggested that for a workforce, we needed to have better communication because what? Most of the medical errors, and any of us that have spent any time ever in our career in doing handoffs knows that sometimes you do a good handoff and sometimes we don't do such a hot job of that. Even when you're in a critical care environment. And I say that because in a critical care environment, you usually have more close proximity to people at shift change than you do in some of the other units. And yes, I've been on other units, both with students and as a nurse. And that report was led by Mary Wakefield, a nurse who was very interested and very committed to looking at bringing forward what an important role that nurses play in healthcare. I say at most of my graduation speeches is that we're privileged to be the ones that serve at the critical time in a patient and family's life, usually at birth and at death. We're also the one that if we're not knowledgeable enough, don't know how to call the rest of the healthcare team in at 3 a.m. when there isn't many other people. And now that most of our care is moving out, or much of our care is moving out into the community, that we're the ones making those visits or being in as the first line of defense in the healthcare arena, whether it's a community or ambulatory care service center, or whether it's in the visiting nurses or it's in hospice care. And that's an important role. But what does that mean? Well, the Mary Wakefield report said health professions education needs to be around a set of core competencies. We already had the competencies that IOM said that we needed from the very beginning, from the 1999 report forward, looking at information, looking at quality, looking at safety, patient safety, only they put those together in the IOM, looking at using evidence and evidence-based practice, using informatics and our information systems so that we can share information. How many times have you had a patient come in, this certainly happened to us in the NICU, and we couldn't get access to the maternal side, to the maternal chart, to the maternal information except what was given in the handoff, because I worked at a children's hospital, so everybody was transported in. And looking really at that communication across the healthcare team. So setting a core competency around, or setting core competencies, I should say, around our educational process. It wasn't sufficient any longer to be just in practice and doing continuous quality improvement. It wasn't sufficient to do M&M rounds and look at what happened with morbidity and mortality. It was necessary to bring those core competencies into our professional programs. That was 2003. And for some of our programs, I think we still are light years apart in terms of our professional education. It's also why we do the IPEC now, more of the interprofessional education, and also use simulation as a way to bring students together in a safe environment. Because a few years ago, there was a report that said 80% of the new baccalaureate nurses were coming out of their program having never called a physician, never given a lab report, never having had that conversation. So that's really important. And that led, over the course of this time, to CUSN realizing the only way we were going to get those critical pieces of information into nursing curricula was if there was actually an institute that could be created for quality and safety, and that those competencies that were specific to nursing could come into the nursing education programs. So that's how CUSN came to be. And I know that Dr. Altmiller is going to give you an overview more about the journey of CUSN and the CUSN centers. So that just gives you a little bit of an overview of how we got to where we are. And I'm very glad to have been a part of that journey.